how high is the gradient? This is a continuous wave Doppler signal to the left ventricle, 5-chamber view. And here we have the curve. I'll help you a bit. I'll show you the tracing of this curve. This is how I would do it. I would just trace this somewhere here. Okay. And here are the results. 5.5 meters per second. That gives you a maximal gradient of 121 millimeters of mercury and a mean gradient of 7.3. Show you one more spectrum. Here is another one. Here's another one. Here's another one. Even higher. Take a look at this. Now this is almost 8 meters per second. Pooh, this is pretty much. So let me see if you can answer this following question. How severe is aortic stenosis? Okay. Amjad asked if there is aortic regurgitation as well. We'll see if aortic regurgitation is present. I noticed that he seems to know what he is doing, because obviously he knows that the additional presence of aortic regurgitation affects the gradients. But just based on this spectrum, I would like you to answer the question. This is a very difficult question, I must agree, but I want to just help you focus on a very interesting fact that you can see within the spectrum. Okay, 70% have voted. Who says there is no aortic valve stenosis? 5 say it's mild, moderate, severe. Okay. Okay, I'll close. Okay, so here are the results. Okay, most of you said it's severe. So it's severe aortic valve stenosis. Aortic valve stenosis. Aortic valve stenosis. Okay, let me go back to this case. And now I will ask you again, how severe is aortic valve stenosis? Okay. Okay, is there anything abnormal? Okay, so if you have aortic valve stenosis, what do you expect? How would you expect the aortic valve to look? Like this? Is this an aortic valve that you expect to have a gradient of over 100 millimeters of mercury? Okay, you have left ventricular hypertrophy. This would fit nicely to aortic stenosis. But in essence, something is fishy here. And do you know what the problem is? Okay, someone has asked a question. This was Niels. Niels, you have to wait a few seconds until I answer this question, because otherwise I would give away the answer, because you are completely correct. So take a look at the aortic valve, and now take a look at the mitral valve. Yeah. This is a very fascinating study. This is actually a pretty neat study, something I've never seen before, because there are two things on here which you should notice. Look at the motion of the anterior leaflet. You can see that the anterior leaflet here touches the mitral valve, and it touches the mitral valve during systole. In other words, it kind of occludes the outflow tract. And what Neil said is completely correct. There is some form of stenosis below the aortic valve. So the stenotic area is not the aortic valve, which is completely normal. It is below. This is the color Doppler study, which also answers the question of, is aortic regurgitation present? We do have aortic regurgitation, which might be moderate. Let me take a look again how much it is. Here you can see it nicely. It's very difficult to see because you have all these colors going back and forth. What you can do in this case is you can kind of use the slow motion mode where you have aortic regurgitation here. This is the regurgitation. You can nicely see that the jet is not very broad. There is not much flow convergence zone. So AR, at least in my estimation, would be maybe mild to moderate, but certainly not more. But what is even more stunning is we have very high antegrade flow across the outflow tract. And interestingly, we have the flow acceleration below the aortic valve, right here. Okay, Amjad, you have a very good point there. I will tell the rest of the people what you saw in a minute. Okay, so here you can see the outflow tract, and there is a gradient here. Okay. Okay, Ferenc, you have also made the correct diagnosis. Okay, so we see here that there is an obstruction of the outflow tract caused by the mitral valve. But as Ferenc and Amjad also noticed already, there is another problem. Another problem also located below the aortic valve, and that is a membrane. Do you see the membrane here? You can see it even better in the peristernal long axis view. I'll try to highlight that here. Can you see the membrane right here? This is a classic membranous subaortic stenosis. What does the patient have? He has aortic valve stenosis caused by both the SAM, the systolic anterior motion, and the membrane. So high turbulent flow, high gradients, and you have no aortic stenosis. The only thing that I want to point your attention to is the flutter motion of the aortic valve. Do you see how the aortic valve flutters? See that? You can see that in M mode as well. Let me see if I can find the M mode of the aortic valve. Okay, here it is. You see how you see flutter waves and you have early systolic closure of the aortic valve, partial closure. This is caused by the obstruction, by the high velocity flow which hits the aortic valve and thereby kind of closes the aortic valve and swings and causes the aortic valve to swing. And if you look at the spectrum, you could have seen that something is wrong already in the spectrum. Why? Because the nice thing is that you see that there is two spectrums within one. You have the typical spectrum of a fixed stenosis. This is the membranous part of the stenosis. And then you have kind of a dagger shaped within the aortic valve spectrum. This is the dynamic obstruction you get because you have SAM. Okay, so a fairly complex case, which obviously you might have difficulties to interpret, but which does show you very important things that are valid for every patient with aortic stenosis. Look at the spectrum, look at the subvalvular apparatus, and especially look at the valve. If you see an aortic valve which is not stenotic, which is not calcified, then it probably is not aortic stenosis unless you have a bicuspid valve, because bicuspid valves can also look can also not be calcified but very highly stenotic.